Hi. Now we are going to tackle other question on easy learning. Question number 7 of BPCE-011. Question number 7. Discuss the efficacy of family therapy in counseling children with problem behavior. Answer. Without family therapy, children therapy is incomplete. The family therapy did not originally start until the mid 1950s. There were several practices based on this therapy was practiced practiced even before 1950s. Though it were prevalent, it did not have academical shape. The medical psychiatric model and the reigning paradigm of psychoanalysis gave birth to this therapy. It was felt that psychoanalytic treatment had not been successful for patients' treatment. There are many modern contemporary cultural influences, including managed health care, brought quick improvement from the patient and for family therapy. The psychological problems now became the subject of individual therapy and the patient therapist relationship in 20th century. The prevalence of this therapy for family specialized and improved several cases. Freud and Rogers, FREUD and ROGERS, stressed and gave importance of family. They thought that family has an immense role to shape their children because the patient is immensely attached to their parents and the patient should not be dealt by outsiders, relatives, or others. In this way, the role of the parent became crucial for patient's treatment. Now, the patients had to be kept in segregation for their treatment. Family therapy also helped in the realm of understanding and explaining human behavior. They helped to eliminate psychological problem and develop and maintain in the social context of the family. The main responsibility for the problems and the focus of treatment from the internal wood of the individual patient to the entire family. There are two most important concepts. These are A, the process and control of group discussion, and B, role theory. The therapists emphasized on not only the control of the group members for communication but also the way of conversation. The therapist helped them to the technique of families method for improving the way of family for better changes in the patient. The role of each and every family member is also important to relieve the problem of the psychologically affected children. The imitation of one child is transferred to others. If one child is good, she can be the milestone for other children too. The complementary nature of the one member becomes helpful for others. This makes the difficulties easier to change. In this way, shifting of individual responsibility to group dynamics does an influential teamwork to release pressure from one person to other. They all together resolve the issue. With this discussion is over. Now we are going to take another question in another video. Thank you.